Hi, I'm Marybeth Van Horn, and this is Nurse Chats. Have you ever heard that attitude is everything? I've heard that plenty in my life. We talk about daily gratitudes, we talk about all kinds of things that can help change our attitude and keeping it that way for hopefully our life so that we, in times of trouble, can turn to our newfound insights and internalize them. Attitude I've seen so many times with regard to my patients. I heard once, I had a case one time where I was dealing with someone who had a gunshot wound and they were paralyzed suddenly. And I've had many cases of that where somebody was suddenly paralyzed from a tobogganing episode, a diving episode, etc., etc. And Dr. Luck at Craig Hospital here in Denver said something very wise to me once. We were talking about the attitude of the person and the stages of grief that a person goes through when something like this happens. But he said that ultimately the person turns to with their baseline, and whatever their baseline was is where they will be. And so if they definitely had a good attitude to begin with, they likely will have a good attitude once all of the dust settles and once they actually come to grips with what has happened to them, and that will be for life. In my own case, I was severely injured in 2015, and I remember talking to the physical therapist. I was crying. I was having my first stage of grief and I was just couldn't get my head wrapped around the fact that I had been so badly injured. And the physical therapist said to me, "You will recover. Do you understand that you will recover? Some people never recover." And he basically was telling me to have gratitude in the middle of my complete trauma. And I remember thinking, I will recover. And then I was thinking about things that he said all along, that you just have to be patient with the process. There was a woman next door to me in another room when I was in rehab, and every day a little girl came to that room, but the door was always closed. And I kept thinking, well, I just assumed that there might be an older population there. I don't know why I thought that, but I just assumed that it was probably an older person and that was their grandchild coming to see them every day or whatever. When one day I went down to physical therapy and the door was opened, and the woman was there that was about in her 30s, and that little girl was her daughter, and she had lost a leg. And that really hit me that what the words of my physical therapist had said to me is that I will recover. This person will recover as well, but they will have a new norm, okay? So I heard the physical therapist talking to her that day because it was the first day she had her door open, and they were talking about just learning to do things a different way. And I had to learn to do things a different way. And right now we're all learning to do things a different way, different than we're used to. And we're either embracing it, or we're rejecting it, or we're grinding through it, or we're avoiding it in ways that we think are going to help us, such as trying to stay busy in other ways, or ignore it or deny it. But the truth is that this is what we have right now. This is what we're dealing with. And we're going to live a new norm because of this, one way or another. And so I think that today I'd like to tell you more to try to see something different, something that you haven't noticed before about yourself or others in this process that you would like to embrace for the rest of your life. When I was laying there in the hospital bed for a couple of months after my injury, I had to think about things that I needed from the past to get me through, the wisdom of the past. What did I learn from certain things in my life? And I did finally get that, and I did that on a daily basis too. There's a lot of hours in rehab, so you sit there for, let's say, on ice. Oh gosh, I sat on ice so much, maybe 20 minutes 3 and 5 times a day. So that's a lot of time. And then I would take my pain medication and go to sleep. So it was a lot of time sitting in a bed and having to be with myself. And I learned a lot through that process. And I think I also learned a lot that can help me in the future. And I use some of the lessons daily. And one of those lessons is to be grateful and to understand, where am I in all of this? And there are other people worse than me. Nine times out of 10, you'll find somebody worse than you and somebody better than you.